Have you ever wondered what you would do if someone you cared about was having a seizure? A seizure, sometimes called a fit or a convulsion, is a sudden, uncontrolled surge of electrical activity in the brain. Epilepsy is a brain disorder in which the person has recurring, unprovoked seizures. In this video, I'm going to share with you the top 5 signs that this is happening and what you can do to keep them safe. Hi, I'm Tony Coffey, and I see how quick action makes a real difference. I've been delivering and teaching first aid for over 30 years and been a registered paramedic with a major Australian ambulance service. And I'm going to walk you through the top 5 signs one at a time. Number 5 is febrile convulsions in children, if you just want to skip straight to that. Stick with me to the end and I will share with you common mistakes that people make when someone they care about is having a seizure and why it can end badly, and also what you need to do to help them and especially what you should not do. There are several different types of seizure depending on where it started in the brain, and the consequence can vary depending on what the person is doing when they suffer the seizure. Seizures can compromise breathing, cause head injuries, and in rare cases, a prolonged seizure can be life-threatening. In water, it can result in drowning. Delays increase the risk of lack of oxygen to the brain. Aspiration can happen, that is when vomit or fluid is inhaled into the lungs, and also trauma from falling. Fast recognition lets you protect the airway, prevent injuries, and get medical help sooner. We'll now look at what to look for to recognize a seizure. Number 1, the person stops mid-sentence or just stares right through you, and they don't respond to your voice for several seconds, up to a couple of minutes. Their eyes may drift to one side, facial muscles may slacken. They may be chewing or making lip-smacking motions, or they might keep moving in simple repetitive ways like folding a towel, walking aimlessly, all without awareness. If you don't recognize it, they could wander into danger, traffic, hot objects, or just fall suddenly. What you need to do is gently guide them away from any hazards. Speak calmly, but don't restrain them forcefully, and time the episode. If it lasts longer than 5 minutes, call emergency services. If they're pregnant, have been injured, or it's their first ever seizure, call right away. After it ends, they may be confused and tired. Reassure them. Perhaps talk about seeing their doctor again if they've had an episode like this before. Number 2, focal warning signs called auras and localized movements. They may describe a feeling like a rising stomach drop, similar to dropping on a roller coaster, a sudden fear or strange smell or taste, or visual changes that came on suddenly, or even a vivid feeling of déjà vu. These are often warning signs. One arm, one side of the face, or a leg may begin twitching or go weak, and speech can become garbled. If you don't recognize it, it can evolve into a larger seizure. They may be holding a baby or something hot, or be driving when the awareness drops. What to do? If they sense it coming on, help them to sit or lie somewhere that is safe. Gently take over the tasks that they were doing, like holding the baby or turning off the stove. Remove any hazards nearby. Reassure and stay with them, and again, note the time and the symptoms. This helps the doctors adjust their treatment. If awareness stays impaired for more than 5 minutes or movements spread to other parts of the body, call for medical help. Number 3, full body stiffening and jerking. The generalized tonic-clonic seizure that we're most familiar with. A sudden cry or collapse followed by stiffening and rhythmic jerking of the limbs. Possibly blue lips, foaming saliva, maybe with a bit of blood from biting their tongue, or breathing may sound noisy or even pause briefly. If we don't recognize it, head injuries can happen from falls, dislocated shoulders, or inhaling fluid into the lungs if they're laying on their back. What we need to do, ease them onto the floor, clear any hazards away from them, and place something soft under their head. If you can, roll them onto their side to help saliva drain and protect the airway, and loosen any tight clothing around the neck. After movements stop, maintain them on their side and monitor breathing until they're fully alert. Once again, time the seizure from the first sign. Call emergency services if it lasts more than 5 minutes, or if they're pregnant or injured, or if they have another one without fully recovering from the first one. If they have never had a seizure before, or if it occurred in water, they must be seen by a medical professional. Number 4, sudden drop attacks. Atonic or drop seizures have a sudden loss of muscle tone. Knees buckle, head nods forward, they drop things, or they collapse. If we don't recognize it, repeated falls can cause facial injuries or concussions. What we need to do, keep them safe. Keep instructions simple and consider taking a break for what they were doing before. Make a note of how frequently these happen to help the doctor with treatment options. Prioritize head protection. Clear the area and protect the head during the fall. Number 5, febrile convulsions. These are very common in children up to the age of about 6 years old and are brought about by a sudden jump in the body temperature. Febrile means fever. They're usually in response to a viral infection and usually harmless but frightening to watch, particularly for the parents. Most febrile seizures last for 1 or 2 minutes when the movements stop, but the child may be sleepy or irritated for up to an hour before slowly returning back to normal. During a febrile seizure, the child will usually lose consciousness. They may also become either stiff or floppy and make jerking or twitching movements. It is also common that they will go red or blue in the face, their eyes may roll back, and they may be frothing from the mouth. Often they will make gurgling noises when they breathe. What to do? Place the child on a soft, low surface, if you can, so they don't fall and injure themselves, laying them on their side. Try to watch exactly what happens so that you can describe it to a doctor later. If you can, it would be good to record a video of the seizure to show the doctor. Time how long the seizure lasts. Keep them on their side until they are fully awake and then try to remain calm. I know this will be very distressing to watch, but the child needs you to be calm. Be there for them. During a seizure, breathing can be irregular. Lips or nail beds can turn blue, and after the seizure is finished, breathing usually normalizes and the person will be tired and confused or have a headache. If they are breathing but noisy, keep them on their side and clear the mouth of any obvious vomit. Continue monitoring them up to 30 minutes after the seizure and avoid giving food or drink or medications until they are fully alert. If there is no breathing at all, or breathing has stopped for more than 10 seconds after the seizure ends, start CPR and call emergency services. Earlier, I promised I would share with you common mistakes that people make when somebody's having a seizure. But first, what can you do? You cannot stop a seizure once it has begun. You simply need to remain calm and wait for it to finish. The two objectives of helping a person who is having a seizure is to protect them from injuring themselves and make sure they keep breathing. To achieve this, all that can be done is remove any objects that they could injure themselves on, place something soft under their head, and try to roll them onto their side to keep their airway clear, and time how long the seizure lasts. And now, what not to do. Number 1, do not hold them or try to restrain them in any way, as this can cause limb and soft tissue injuries. Number 2, as I mentioned earlier, sometimes the person can bite their tongue during a seizure, so you may see some blood with the saliva around their mouth. They will not bite their tongue off, and it is not possible to swallow your own tongue. So don't put anything in their mouth at all, ever. If you try, you can get bitten yourself, you can break their teeth or break their jaw or block their airway and choke them. No hands, no fingers, no objects, no medication, nothing, until they are fully awake and talking. Thanks for your time. If you found this useful, hit the like button below to help other mums and carers see it, and share it with family members who look after elderly relatives and children. If you've got questions or have any other topics you would like me to cover, drop them in the comments below and I can make that happen for you. Down below you can also find useful links such as a printable chart about seizures. If you're in Vietnam and would like to co-host an event with me presenting, check my website link below and also check Survival Skills Vietnam website for a range of online and face-to-face courses that you can enjoy. Stay safe and care for each other.